our webinar. So warm welcome to everybody that's joined us today from different parts of the world. Welcome here to our webinar, Air Quality and Viruses. Obviously a very, very important subject, both how we can manage air quality in terms of limiting the survivability of the virus that is hitting us at the moment, and then as well air quality on the outside. What can we do to improve it? What is the linkage between the two? I am really grateful that I have two excellent experts with us today. There is Albert Groenwoud from all the way from the Netherlands, sitting in his home as we all do nowadays, and he is the head. Yeah, welcome, Albert. And he is the head of healthcare at uHoo, and they have recently launched a virus index, which I was amazed with. I have the uHoo app on my phone and the device as well at home, and it's very, very interesting to see how you can calibrate your own indoor air quality. We will hear more about that from Albert in a short while. And then we have Paeng Lopez from Healthcare Without Harm. He is campaigning for the Healthy Energy Initiative, and he's an expert on mainly outdoor air quality. He's done some work on indoor and as well renewables. So those are our two amazing guests. I'm really looking forward to hear from them. And I would love to hand over to you, Albert, to kickstart with your presentation. Maybe you can do the screen share. Should be working already because I switched it on a while ago. Is everybody out there okay? Maybe you can share in the chat function where you are from, and you can as well share in the Q&A section. If you have any questions coming up, we can do that as we go along. Please feel free to add them even during the presentation.
Okay, Matthias, thank you very much for the invitation to discuss with people around the globe ways to protect ourselves to the COVID-19 infection. In the next 5 minutes, I would love to introduce to you the virus alert, which was powered by uHoo. Then I will go a little bit more into detail about the global and local situation of the COVID-19 epidemic. Then I would also explain the uHoo virus index, and that means how you can identify the spread of viruses. And last but not least, I want to highlight some precautions to avoid transmission and minimizing the risk of a virus infection. The uHoo virus alerts utilize air quality data within homes and workplaces to create an environment that helps to deactivate viruses and to enhance the immune system to be less susceptible for virus infections. COVID-19, the pandemic, belongs to the family of the so-called coronaviruses. Those viruses are among the population already for many centuries. The first coronavirus infection was recorded 2,800 years before Christ. Everybody remembered, of course, the SARS virus infection in 2009. And we should keep in mind that also in the future, we will be confronted with a lot of coronavirus infections. These viruses take place because the coronavirus likes to sit on a natural host. It could be a mouse, it could be a bat, and then it will be transmitted to a cow or a monkey or all kinds of animals. And then it will be transmitted to the human beings. And keep in mind that due to the changes in the environment, these virus infections will take place also in the future. Coming to the symptoms of the COVID virus infection, you see that if you look especially to the respiratory tract system, that in the beginning, people are coughing, they have throat irritations, they have a stiffy nose, sneezing, eye irritation, and shortness of breath. But these symptoms you can also find when you have allergies, cold, or the flu. And also they are seen with air pollution. So in the beginning, it is very difficult to distinguish what's happening with yourself if you have a COVID-19 infection, or are you facing air pollution? Later, in the later phase, COVID-19 patient, they will have headaches, fever, and one of the is the loss of taste. Recently, the Dutch Health Institute has reported a research which was done among 10,000 of people who were affected with the COVID-19 infection, where they were located when they got the infection. And what you can see here that most of the people, they got the infection when they were at home or at work or in care homes, senior homes, hospitals and schools. So the take-home message from this slide is that the majority of the COVID-19 infections and also corona infections will take place inside a house or inside your working place. Research has been shown that air pollution is one of the causes of the death of the COVID-19 patient. It is an airborne disease. And people living with a poor air quality indoors and outdoors are more susceptible. Particulate matters, they can seen as a kind of carrier for the COVID-19 infections. And if you have not sufficient ventilation, they will stay inside a room. Also, humidity levels and temperature are playing a role. And last but not least, pollutants like NO2 and VOCs are really affecting the immune system of people. So all these kind of factors are playing a role in the COVID-19 pandemic. If you look inside the house, it has been shown by scientists that humidity and temperature, especially the relation between those, are playing a role. Also, air ventilation is important. I was mentioned before, particulate matters, which can be seen as a carrier for virus infections. Also, volatile organic compounds containing disinfectants are playing a role. And last but not least, also NO2. Coming now to the so-called uHoo virus index. Based on real-time data, real-time monitoring of the indoor air quality, uHoo has created the so-called virus index, which you can see on the left side of this slide. Here you can see all the parameters which we are measuring in real time. And then we have created this index. It means and it's a range from 0 to 10. So 1 to 3, then the environment is okay. Virus survival is low and airborne virus spread is unlikely. If you go from, you see on your screen 4 to 6, then the virus survival is moderate and there is a possibility of a virus spread. Then of course you can have 7 to 8, the virus survival is prolonged and the airborne virus spread is likely, and especially then you have to take measurements. And then at the end you have the severe cases. Oh, sorry. Okay, the severe cases, the virus is high and airborne spread is likely. What things you can do? These are kind of very simple things you can do yourself to protect yourself against these coronaviruses. Wash your hands with an alcohol-based sanitizer. Keep the distance at least 1 or 2 meters. Try your best not to touch your eyes. Cover your mouth when you're feeling sick. Seek medical attention if you're difficult of breathing, and pay attention to the virus alert in your house or working place. Simple things you can do at home or your working place. Keep the humidity between 40 and 60%. The temperature should be 90 to 24 degrees Celsius. Keep a proper ventilation. Keep the levels of CO2 below 800 ppb. Take care that the particular metals levels are under the 15 ppb. Use low VOC disinfectants and keep the levels of NO2 below 53 ppb. Thank you for your attention, and I'm really looking forward to a further discussion about this topic.
All right, thank you so much, Albert. Excellent presentation. Not sure whether you realized that I disappeared in between. My internet connection is a little bit choppy, but I hope you can hear me all. If that should happen later, just keep going with the questions, and it's Albert with excellent advice.
Okay.
I think if I can sum it up, Albert, if we keep good air quality that's healthy for us at home, we at the same time are durability of the virus itself.
Yes, that's correct. It's a simple message.
Is that a fair statement?
It's absolutely fair statement. And the air quality is playing a crucial role also in the spread of virus or other issues. And I'm glad that with uHoo, we have created this alert and this index. We have launched it recently worldwide, also via the social media, and we have received a lot of positive reactions. To be honest, I'm a scientist. In the beginning, I was a little bit afraid of getting a lot of criticism, but the reactions are very positive to have this kind of approach to deal with coronavirus infections.
Great, great. So we will come back to the questions
Matthias,
later on.
there?
And thank you so much, Alex, for asking the question. I will hand over to Paeng now. Paeng, your turn.
Yeah.
Please give us an insight onto the outdoor aspect of pollution.
Sure. Thank you, Matthias. And thank you for that, Albert. So it paves the way for my presentation this afternoon. So I'm going to share my screen with you guys. But Albert, you have to stop sharing your screen first.
Okay, sorry.
It's okay. All right. Can you guys see this?
Yes.
Okay. All right.
Yes.
Okay, thank you. So just a brief introduction on Healthcare Without Harm. Healthcare Without Harm is an environmental organization that works with the health sector, basically to underscore the health impacts of different environmental problems. So we're present in 55 countries around the world, and we have around 1,160 members worldwide, which represents about 36,000 hospitals and health centers. We've been working with them for 2 decades now. And one of the campaigns or issues that we work on is air pollution. And just to inform the discussion this afternoon, so air pollution is defined as any substance in the air that may harm humans, animals, vegetations, or materials. So we work with the health sector in order to protect the public's health as well as the environment. So in recent years, WHO came out with a study that revealed that 9 out of 10 deaths occur in the developing country. Unfortunately, Philippines is one of those countries, which is why we're focusing on air pollution in the Philippines and different other countries in the region. But just to let you know that air pollution threatens also the poorest sector. So not just the poorest nations, it also affects the poorest sectors of those poor nations. So that's a lot of numbers. 7 million is a lot of number. And these are the kinds of illnesses that may be taken from or gathered from the air pollution if we're left vulnerable to it. In the Philippines, as I've said, we're one of the highest in the region. So the just clip here, the story should actually say that the Philippines is third highest in terms of air pollution deaths in Asia. So we're third only to China, which is the first, and then Mongolia is the second, and the third being the Philippines. So we have quite a high number of deaths per 100,000. So that's 45.3, as you can see in this slide, and that's a lot of numbers um, for the Philippines. Um, so what is this connection? How is this connected to COVID-19? In recent news, it was highlighted that air pollution actually increases the vulnerability of the sectors in terms of uh, the coronavirus. So this means that in places where there are actual um, worse qualities of air, the population would be exposed to, or more they're more vulnerable to being exposed to the virus. And this means there's a lot of sector that are exposed, especially if we talk about urban centers like Metro Manila. And this is just to show you, these are the kinds of air pollutants that we monitor. So um, we call them the particulate matters. So they're really fine, really small dust in the air, and they come in different sizes. So PM10, you can see the comparison to human hair, etc. And depending on the size of the particulate matter, um, it could affect different parts of the human body as well. So if you have a weakened body in the first place and you get exposed to air pollution, that means it underscores the research of WHO that you're more vulnerable to COVID-19. And just to show you, these are the numbers in the region when it comes to deaths to air pollution, and you would see all the organs that are affected by air pollution as well. So if you are a part of the sector or part of the population that are exposed to different sources of air pollution, then chances are your susceptibility to the virus would be greater than the others, or compared to those who are living in places where there are healthier air compared to yours. And these are some of the examples that are given by the International Respiratory Society in terms of tissue damage to the different pollutants caused to your lungs. And these are just, mind you, the lungs. So not this is not in any way showing all the other organs that are being affected by the air pollution. And who are the most impacted by air pollution? So if you care about women, if you care about children, etc., if you care about the next generation, then it's going to be a cause for alarm to realize that they're most impacted by air pollution, which means to say that they're also most vulnerable to the coronavirus if we let them, be exposed to different kinds of air pollutants. And just to show you as well, I placed here a comparison of the different greenhouse gases vis-a-vis the sources of air pollution. And you would realize that if we try to solve one problem, so the climate apart from this coronavirus or COVID-19 is one of the biggest health threats we are facing right now. But if we try to solve, for example, one source of air pollution, then we'd be solving one source of greenhouse gases as well. And and that means there's a co-benefit in trying to solve air pollution, whether it's indoor or outdoor air pollution, as Albert has mentioned earlier. And these are just to show you, these are the air quality standards in the Philippines. The WHO standards are much lower than the Philippines, um, but these are the current standards. And just want to point out as well that while WHO said that 9 out of 10 people worldwide are breathing unsafe air, a lot of them don't have access to real-time data when it comes to air quality. And products like uHoo are actually some of the products that give you information, real-time information on what the air quality in the places where you are right now is at. Um, so just to share also, during the COVID-19, during the lockdowns here in Metro Manila, we found out through our air monitors that all throughout March, the air quality in Metro Manila conformed with the WHO standards, 24-hour standards. So the average for March was 17.32, and for that's for PM 2.5, and for PM 10 that would be 22 parts per million. So it's way compliant to the WHO standards, which prior to the lockdowns in Metro Manila, we breach every day. So we were breaching not just the WHO standards, we were breaching the PH standards, the Philippine standards as well. And this was only breached only in May when the lockdown started easing out in different areas in Metro Manila. So in closing, I just want to tell you that we work with the health sector because we want them to be able to treat their patients really well, and be considerate not just of the health of one patient, but be considerate of the health of the environment in which they live in, because it's pointless to keep curing people, especially in hospitals, and only to send them back in environments that are making them sick in the first place. So it's very critical to keep a healthy environment, healthy air indoors as well as outdoors. And that's it. Thank you very much for listening.
All right. Thank you so much, Paeng, for an excellent. Did I understand it correctly that the local standards are more stringent than the World Health Organization parameters?
No, the WHO parameters are more stringent than the Philippine standards. Yep. But we were able
Okay, the
to
other
meet
way
both
around.
during
Yeah.
the yep. But we were able to meet both during the lockdowns here in Metro Manila.
Yes, yes, yes. Those were the days, right, which are more or less over already. I am not in Manila. I'm based in San Pablo City, but I heard that the air pollution levels in Manila are back to where they were previously. Is that correct?
Unfortunately, yeah.
Yes, yes, that is quite a sad realization. So, question for both of you. Currently, is the air quality that you've been measuring actually better inside or outside? And what is the relationship between inside and outside air quality?
Perhaps I can start. Normally speaking, the air quality inside is 5 times worse than outside. But during the corona pandemic, the outdoor air quality, especially here in Europe, improved because there was no air traffic, no traffic on the roads, everybody was staying at home. And so the air quality outside was improving. But now the lockdown is lifted. The air pollution is not so good anymore outside. But inside, it even got worse because people were staying inside. They were crowded. There was not enough ventilation. So overall, I would say that the indoor air quality during the corona pandemic could be even worse than it was before.
How about your point of view, Paeng?
Yeah, it's a tricky question because it depends. In my point of view, at least, it depends on where you live, and the conditions of the environment where you live is. And Albert is right. Actually, for during the lockdowns, we all are staying at the inside our houses, and that tends to, we're exposed to more pollutants indoors if there are any in our houses. But the environment outside, also poses different kinds of air pollutants, as we've discussed, and both could be very dangerous. And I think that indoor air quality is just as important as outdoor air quality, or vice versa. It's important to keep both. It's important that we are able to breathe without fear of getting infected with anything or getting sick of any pollutants.
Yeah, just to inform our guests, we will be discussing another 5 to 10 minutes, but please start sharing your questions to the panelists, and even if you have a question for myself as well, aloud. I just want to share one experience that I had. I was sending a message to my wife last year while I was traveling. Hey, honey, how come at home the PM 2.5 is so high? What's going on? What's wrong? And then she said, "Oh, darling, don't worry. It's just my brother is here, your brother-in-law, and he has been burning his omelette when he was cooking. So don't worry." So indoor air quality monitoring can be so sensitive that you can detect what's going on in the kitchen. But I have PM 2.5 problems, usually early in the morning and late in the afternoon, evening. I'm sure, Paeng, you have a good idea why that is the case. And I would love to ask our audience, please comment in the comment box, what do you think is the reason why I have a problem with PM 2.5 here in San Pablo City occasionally, early in the morning or late at night? I guess the Filipinos might know it. Maybe I have a prize for the person guessing the correct thing. So please make your comments in the chat box and share with us what you think is the root cause of that PM 2.5 problem. Now, another question for both of you, Albert and Paeng. I wanted to check with you, what do you think we can do to ensure that indoor air quality is given more attention in offices, in hospitals, in enclosed spaces in general, considering that it's so important, but that traditionally very few people have measured it? I was giving a talk at an HR conference in Manila last year, and I asked the HR people, please raise your hand if you know what is the air quality in your office at the moment. There were about 250 people there. Not a single person raised their hand. So it is not really happening on a large scale yet. Now we realize even more how important it is. What can be done to really make it happen on a larger scale?
I think first of all, there are no strict regulations for indoor air quality. I mean, outside there are strict regulations, but inside there is not. And I think all of us should work on that. Take, for instance, the equipment which take care of the air ventilation. They are not checked regularly. It's not necessary. Cars have to be checked on regular times, but these systems to filtrate and to clean the air are not necessary to be checked. Secondly, I think people should get aware that indoor air quality is not only bad for your health, but also has an effect on productivity and everything in an office. And thanks to, I think, organizations like the Green Building Certificate, more and more attention is being paid to the indoor air quality. But certainly, it's not enough. And we should highlight every time again that indoor air quality is absolutely a necessary good air quality.
Yeah. If I may add to what Albert has already said, yeah, it's true that especially here in the Philippines, we don't have a regulation yet for indoor air quality. So we have the Clean Air Act that's been passed like 20 years ago, and it discusses outdoor air quality, and there are no standards yet for indoor air quality. So we have this notion that if you're sheltered inside an area, whether it's an office or houses or office buildings or schools, etc., that it's safe because you're sheltered. So this notion has to be, debunked and showed that indoor air quality can, or it's possible that indoor air quality can be as dangerous as outside air quality. And the only way to show that is to keep measuring. For people to be informed that this is the kind of air quality that our people are actually breathing inside their homes, houses, offices, schools, etc. But until that's really done, until that initiative is popularized in all sectors of society, then indoor air quality will remain to be behind the car of the behind the discussions. It's always going to be behind outdoor air quality, but it needs to be at par with outdoor air quality, because it's, as I've said, it's just as important as outdoor air quality.
Yeah. And I think it has also to do with changing the behaviors of people. I mean, if you look at the indoor air quality, we have some use cases where we are measuring the indoor air quality in a kitchen or in a sleeping room or in the living room. And what we see, because also uHoo provides guidelines what to do if you're outside the range, then it gives you advice what you can do to improve the indoor air quality. And over time, when we see changes in habits, and people are working on it to improve their indoor air quality, that's what we are seeing at the moment. Coming back, also we have done also some research about the relation between outdoor and indoor air quality. Some of the pollutants come inside, but most of the pollution is taking place inside. That's for sure.
Yeah, I remember as well last year there was an article that was saying Calamba was the cleanest city in the Philippines. And I kind of had a little smile on my face, because I thought, oh, that really depends where you put the monitoring system. So at this point in time, we don't really have much data as far as the Philippines is concerned for either outdoor or indoor. We could really answer the question, what is the cleanest city, if we would have, in a couple of different locations of each city, a proper continuous air quality monitoring. And when I went to the DNR and looked at their monitoring station to repair them, get them fixed again. So we have actually very limited data at this point in time if you look holistically at the Philippines as a whole. But I think, Albert, in Holland, you have done some research on what is the linkage between outdoor and indoor. And if I remember correctly from your past statement, you came to the conclusion that most of the pollution that you monitor indoor is actually generated from indoor as well. Is that correct?
Yeah, that's correct. That's correct. That's correct. Especially also look at NO2 levels or other pollutants which are inside and outside. The most of the pollution taken inside. The volatile or organic compounds which can come from paint, carpets, old furniture. PM 2.5 is caused with the increased levels by the cooking habits, not using the hood properly. Also, when you are in a sleeping room, for instance, and you have not enough ventilations, then the CO2 levels, they go so high that it has a direct effect on your sleeping rhythm. So, I mean, we can do a lot of things ourselves at home. I'm sure about it.
Actually, I was in a hotel, and when I booked in there, I brought my uHoo along, and I discovered that at night there was a very, very high level of CO2 on there. And then the engine switched off the fresh air supply to save electricity. And his comment was, high level of CO2 makes you sleepy, shouldn't be a problem at night. So Albert, is that from what you just said, it sounds a little bit different, right?
No.
It was 2,500 parts per million.
Yeah, basically the man of the hotel was right. It makes you stiffy. I mean, the CO2 levels are having a direct effect on your brains. And it is a natural product. Huh? We are producing it ourselves. And that's why the ventilation in a room is so extremely important. And what I was mentioning also in my presentation, keep the levels below 800. That's because then you feel fine. It will not affect your brains. It will not affect your productivity, and it will not affect your sleeping rhythm. Yeah. It's interesting to see.
I should have asked for a refund. I should have asked for a refund in that hotel because it was 2,500 parts per million at night.
Oh, wow.
Wow, that's much. Now, yeah, just to be honest, we are also working now with a large hotel chain to see what we can do to offer the guests a very good room. Because you can also put the uHoo in a room and show in advance the air quality which was measured in that room. So it is all feasible. Yes. Yes.
So coming back to that discussion outside versus inside, I think your conclusions in the Netherlands are slightly different than my conclusions here in the Philippines, because more time, and David and Alex, who answered in the chat box, small fires for cooking, outdoor fires, guys, how come you know? Maybe David already listened to a different webinar that I've given in the past where I might have raised the same point. But here in the Philippines, my PM 2.5 goes into night when in the neighborhood people do. To enforce that is very, very difficult. A lot of indoor air pollution coming in from the outside.
Sorry?
Our audience has been asking. So David and Alex, you will get a little reward. Can you guys still hear me? I switched off my video to reduce the bandwidth, but my internet connection is still not 100%, but you're still okay hearing me.
Yes, it went spotty for a while.
Yes.
It's good now.
Okay, good. Good, good. Glad to hear that. We had the first question that was in the chat box was from Alex. About the high or low humidity. I think, Albert, correct me if I'm wrong, the optimum level would be 40 to 60, but you mentioned as well that the virus infection in the chat box answer would...
Yeah, I will try to, I have also responded to that. What we know about coronavirus infections, that the problem is the low humidity, so under the 30%. It is fascinating if you look at viruses and also bacteria. There's a range. Some of the viruses, they like high humidity to survive, and other ones like low humidity to survive. And for the coronavirus, it appears to be the low humidity and also low temperature. That's why a lot of people got infected in the mountains during winter season here, where the temperature was below 7 degrees Celsius and the humidity is low. That's also one of the reasons why they think that this low humidity is bad for the coronavirus.
Yeah, I think in Europe, the hotspot...
Another question was, actually...
Yeah, go ahead, Albert.
And also, I said one of the questions also, which was asked also, can you connect the devices to clean the air to uHoo? Yeah, that is feasible. It's possible. We built in technology that humidifiers and also air purifiers can be connected to the uHoo device, so that you get so that you can improve the indoor air quality. That was one of the questions I saw passing here. Yeah. Let me see another. Yeah, also talking about the fireplaces. What we have seen also here in research, that people are using open fireplaces and also so-called using bio oil and those kind of things. The PM 2.5 levels increase as well, also the VOC levels. So it looks healthy, but it is not the case. Yeah.
Mm.
There's a question
Yeah.
here from Harleen, but Paeng, you can make your comment first, and then I go back to that question.
Yeah, I just want to add that in
Okay.
terms of indoor air quality here in the Philippines, so as I've mentioned that there's no standards for indoor air quality yet, and for rural areas, as you've mentioned, the air quality becomes significantly worse in the morning and in the afternoon because it's time for their cooking. And a lot of kitchens, unfortunately, in rural areas still use firewood, for instance, and sometimes in really bad situations, they use plastics to start kindling the fire, which makes things a lot worse indoors. So I forgot to mention that during in the WHO research that in the Philippines, that's what's making the indoor air quality really bad.
Yeah, and I can smell that, and I can see it on my uHoo data. I can smell the plastic in the fires. So some
Yeah.
people, they don't even bother to properly dispose of their waste. They just decide to burn their waste in their backyard. And one next door neighbor that I went to and actually challenged them, she said, I'm just burning some leaves. So I had to show her the actual data on the uHoo that was indicating this is toxic levels. And I asked her, why don't you use the leaves for organic fertilizer? I mean, it's nice biomass. That would be a nice use for it instead of burning it. But this is traditionally what people do. It's very, very difficult to change that behavior. And I, as a foreigner, have to be careful as well not to make too much noise. Otherwise, I will get a bad reputation in the neighborhood.
Yeah, that's true. As far as exemptions go, agricultural burning, especially after a season of harvest, is exempted under the Clean Air Act. But open burning of like small lumps of leaves, etc., that's not allowed under the Clean Air Act. But you would wonder why small burning of piles of leaves is not allowed, but huge piles of hay, etc., or post-harvest from rice fields would be allowed in the Clean Air Act. So there's a sort of a disconnect right there that needs to be resolved for in the law that we have.
Yeah, and that high volume of material,
Yeah.
if you could use it as biomass for a specific purpose like fertilizer production, methane or whatever else, or even a controlled combustion where you use it in a waste to energy kind of way if you scale it up, even though you need the proper pollution controls there as well. Otherwise, what Albert mentioned, sometimes we see in Europe particulate emissions coming from those biomass power plants.
Yeah.
I'd like to add
Question
that
here
the
from
danger of
Harlin, who was asking, yeah.
no, I'd just like to add that in terms of exempting agricultural waste, we shouldn't have had exempted them, especially if you take into consideration that a lot of our rice fields are sprayed with petrochemical-based fertilizers, insecticides, etc., etc., etc. And then at the end of the day, if you burn all of that, so you don't just burn hay, you also burn a lot of chemicals and put them in the air for people to inhale. No, so the danger is really really staggering if you consider it. It's not as healthy as
Good point.
people might
Good
think.
point.
Yeah, traditionally the people here in the Philippines think that when they like burn piles of grass or leaves under a tree, that would make them um, blossom some more for fruits. But it's really bad because they'd be inhaling pesticides as well, and it puts them in a very very vulnerable situation to other diseases like the coronavirus.
Matthias, maybe I see an interesting question from one of the attendees concerning working at home. Due to the coronavirus pandemic, a lot of people are forced to work from home, and that seems to be also the future. I mean, companies are now looking at the fact how how can we arrange that people are working at home and also in the office? And the question was, then should the employer not provide equipment or monitoring tools to improve the indoor air quality at the houses where the people are working? The same counts, of course, also for the working places. I mean, if you are monitoring the air quality correctly, then the place where you are, you can say it is safe to work. This is safe to be. I think in the future we have to see that air quality is a benefit, good air quality for your health and your safety. And I find it a very interesting suggestion from one of the people said, why should the employer not provide equipment so that the people can work from home safely and in a good house? A good one, yeah.
I think this is a great suggestion, but maybe it will work in the developing countries where we have already very good internet connections and awareness at the organizational level on the importance of indoor air quality for productivity. Good internet connection in many places.
Yeah.
And virtually, as I mentioned earlier, place of work. So we have a very long way. In the chat box, Alex Mack here mentioned, maybe, have you seen that, Albert?
Which one? I see many.
This is one for you as well. But then the temperature goes to 34.
Yeah, he's using, is that the one, he's looking at the CO2 levels in his bedroom and also...
There is a correlation, in his opinion, between humidity and CO2.
Yeah.
To me, it seems like Alex is based, somewhere here in Southeast Asia because of the high humidity level when he opens up the doors, right?
Yeah, that's true. Yeah, because to be honest, I mean, 34 degrees and then high humidity, that means that, from my perspective, be careful, because this could also lead to other kinds of infections. I mean, what I was mentioning before, you have some viruses with like high humidity and high temperature, or even mold can take place, mold infection, mold in your house. I mean, this is not a very healthy environment, to be honest. And you should keep the humidity lower than 60%, but apparently it's very difficult in your part of the world.
Yeah,
I'm honest about it. Yeah.
And it also tells me that he lives in a place where there might be other sources of air pollution too. So are there lots of burning around the place where you live in? Are you near a busy street, for example, etc.? So those are the considerations that you should think about, and they could be the possible sources of CO2 whenever you open your doors.
Albert, if you go one further up, there's Anton from the Netherlands. He is asking, what is the recommended refresh rate in offices?
Yeah,
he is focusing at. You've got a comment on that?
Yeah, I just see it in front of me, Anton. I think basically you're doing well, to be honest, if you use the figure which is mentioned here. But on the other hand, don't forget you need to measure the CO2 levels, because that is the marker, or the marker for the, I would say, the air ventilation. And it could be what we are seeing, that sometimes in offices it is being set on a certain level and not changed anymore. But you can use the CO2 levels to regulate it. Sometimes you need to put it a little bit higher, and in other cases you can put it lower. We have done I think, a very interesting use case in Asia, where we had a big conference room where you have this equipment to clean the air, to regulate the temperature. And that was put on already, I think, 2 hours before the meeting starts. And then thousands of people came in. And then it turned out to be that you can switch on this equipment a little bit later and then save energy as well to have a good and proper indoor air quality. So you need to steer your equipment based on CO2 levels. And our recommendation is keep it below 800 ppb. That is my recommendation, especially in the time of the coronavirus.
We had some interesting theories as well from Chris and from Elmer about the PM 2.5 early in the morning.
Yeah.
I think that's worth further exploring with regards to the air cooling and expanding, but we haven't answered the two questions of Harleen. One of it was, does uHoo identify accumulated dust on furniture and other electrical products? And the other question was linked to, what does uHoo recommend? And is there a air cleaning device by uHoo as well? As far as I know, there is no air cleaning device, but it integrates well with other air cleaning devices. And uHoo has in the app recommendations what you should do. For example, if my CO2 level is too high, it will recommend me to open up the doors, the windows, and get the fresh air circulation in. Those recommendations are all in the app. And the virus index that Albert was talking about. Albert, could you be so kind and put in the chat box the link for the virus index? People can actually download the document free of charge. It has a lot of good scientific reference articles in there. It's scientifically a very solid framework. I think some of those questions that have been asked today, you can get more insight by actually reading the document. But correct me if I'm wrong, Albert, there is no measurement of accumulated dust on furniture or other electrical products, but the more dust you have accumulating, the more dust blows into the air. When there is air movement, the more PM 2.5 you get. So there's a correlation between the two.
Yeah, absolutely. That's the correlation. We are measuring the particulate matters which are flowing in the air, and not the ones who are on the table. But you can assume when there's a lot of dust in the air that it will also be on your table or on the ground. Yes, but we not directly measure it. That's correct. There was another question. Oh yeah, also if you look at our app, you see equipment from humidifiers or air purifiers, which can be connected directly to our devices via IFTT. And one of them, I don't know, I'm allowed to make some publicity, but Blue Air is doing it. You can use Blue Air equipment, which is working perfectly.
And I'd just like to add as well that sometimes when we talk about technology, we tend to get super focused on technological fixes. But just want to point out that in terms of if you're looking for air cleaning devices in nature, you have plants. So the more plants that you have, ideally at home, the better it would be in terms of air quality. And as far as dusts are concerned, it's really hard to just find a solution for that in terms of gadgets. But you really have to do for now manual cleaning. But for gases that are posing danger to houses, offices, schools, etc., it would be really helpful if you have plants that would help you clean the air. And they're cheap too, not as expensive as possibly any other air cleaning devices out there.
Yeah, we have one or two people asking as well, what is the best indoor air quality monitoring tool? I mean, we might be biased here, but I would say uHoo. It's the most comprehensive one. And I have had two different ones in my home. And the other one, after some time, I realized there's a problem with calibration here. Something is out of sync. So I have mopped that in my cupboard, and I'm only using the uHoo at the moment because the data that I get makes sense. And now with a virus index, I have additional quality information that can help me to calibrate things as well. There is a question from Elmer. He is asking, we were saying in the presentation, we talked about total VOC, but not about CO2, but then in the virus index, we use CO2, but not total VOC. Yes, CO2 is very critical as an indicator how, whether you're getting fresh air in or not. Albert, any comment? Why is the total VOC not covered in the virus index?
It is because it's the total volatile organic compound composition, and which also includes formaldehyde. It's the composition. We have not included it directly in the index because there is no hard proof at the moment that VOCs having a direct effect on the viruses. It has an effect on the people who are inside the room, because it will suppress the immune system when you are confronted constantly with high levels of VOCs. That's why we have not directly included it in the virus. But if you open the app and the index at the same time, it will show you what your levels are for the VOCs. So it's a kind of combination. I hope I'm clear, because it was not included because we have no scientific proof that it is directly affecting the virus spread. We know that disinfectants could kill the viruses, but that's why we have put it a little bit aside now in this index. I hope I'm clear.
Yes, very, very clear, very logical explanation. Thank you so much, Albert. And we have a question here as well from Elmer. Is there any trend for air conditioning manufacturers to incorporate fresh air ventilation into their system to address the CO2 built up with split type air conditioners? Now that's an interesting one. I mean, the big HVAC systems for the office buildings, usually the air handling units are responsible for bringing in the fresh air supply. And interestingly enough, the big breakout of COVID infection last week in Germany at an abattoir where 1,300 people got infected, the technical analysis from an expert identified that the main reason was the HVAC system was not bringing in fresh air, but recycling internal air, and with that distributing the viruses continuously all over the place. And we have seen the same with other studies, like the famous Guangzhou restaurant where people got infected sitting next to a person from Wuhan, and that seemed to have been because there was no fresh air coming in, and the aircon blowing seemed to distribute the virus particles to those other two tables that were within 1.5 meter distance to the table of the infected person. So will in the future air conditioning manufacturers for home include fresh air supply? I don't know. It will make the aircon systems much more expensive. You need to reduce the humidity. If you bring in fresh air and the temperature, that makes it very costly. That's why people avoid 100% outside air, because the extra cooling that is required will be gigantic. But then on the other hand, I don't know whether my friend from the Datai Langkawi is still on the call here, at least he registered. They have a separate system for supplying low humidity air to their guest rooms, which is will avoid the mold. I have been in hotels on the seaside. They have the aircon running all the time at full power, even though there's no occupancy, just to fight against the mold. It doesn't make sense, guys. So this is all a question. And when I recently bought an aircon here, I bought a very nice aircon with inverter. It cost a lot more. And the sales guy here in San Pablo City was telling me, oh, nobody else buys inverter here. Even though I calculated, you know, it takes 5 months or a little bit more to get the ROI, but he said people buy the cheapest aircon. And if the aircon would then cost another 10,000 pesos or 20,000 pesos more with fresh air coming in, I doubt it would be a big seller here in the Philippines, at least. But so I don't know whether it's coming. But Elmar, if you can get 10,000 people saying, I want that aircon, I'm willing to pay 10,000 pesos more, then maybe Daikin and other guys will come up with it.
Perhaps we can take an example of airplanes. They have a system where they bring in also fresh air, and it is under difficult circumstances, high in the sky, and they have techniques to bring in proper and good air, fresh air. In the past, they have reduced it because of energy savings. That was the issue why a lot of people get ill in the plane. But nowadays, this equipment is on full speed, and they are able to bring in fresh air. That is something perhaps also could be brought to offices, buildings by these kind of companies. It could be something, I guess. I see, by the way, that it is our virus index. The scientific information is in the chat. Yes. It's posted by my colleague Jeroen Bouvet, so everybody can download it, and it would be great if everybody's reading it and give some comments to me, because I'm very curious about it. Yeah.
All right, guys, download it, read it, and let Albert know what you think about it. Give him the pat on the back if you are impressed for his scientific contribution, and you know, give Paeng a pat on the back for his burning mission to improve the air quality in the Philippines, both outside and inside. I think we can do some work on the hospitals and the inside, particularly with hospitals being the place where we should have optimized the health situation, and healthcare without harm. I think is really a symbolic mission for both outside and inside. So we have overstretched our time already, but I think we had a good and lively discussion while trying to answer the questions that came in and the good comments from our participants. Maybe both of you, a final conclusion. What is your vision for the future, and what do we need to do to make this become very, very big, so that in the near future, everybody, every office, every home has indoor air quality monitoring and management as part of keeping us healthy in the new normal?
Yeah, I think one of my missions is that everybody around the globe, I think, deserves a healthy and safe environment to live and to work, and that also accounts for air quality. Because sometimes I say, without water you can live a while, but without air you cannot live longer than a few seconds. So I mean, I think that would be my message.
Paeng?
For my part, since you've mentioned the new normal, I'd just like to point out that if there's anything that the lockdowns have revealed to us, it's a fact that a good air quality can be achieved. So we were able to experience how it is like to breathe good air quality or fresh air from the places where we live here in the Philippines, if only for a while. And with that knowledge, we need to take it, you know, in the future, in defining new normal, that this is the kind of air quality that we want to have in the houses where we live, in the office where we work, or the schools where we go to. This is the kind of air quality that we want to have, and we have to demand that, and we have to make sure that that air quality is part is part of the new normal that we're starting to define. And whether we're able to um, have access to the knowledge that the air quality is good is another matter. But it's really important also that we have good air quality in the first place. And then secondary would be able to have that ability to monitor the kind of air we breathe, whether we're outside or inside our houses.
Great, great. Two wonderful visions. If you don't measure, you cannot manage. That was
That's
the
true.
original reason that I bought myself a uHoo 3 years ago when my baby daughter was born. And we need as well uHoo to come up very soon and fast, hopefully, with the outdoor air quality monitoring tool so that we can use IoT to cost effectively get that data, which is currently costing too much governments. And as I saw at the DENR, they don't have the budget to maintain those monitoring stations effectively, and then there is no data available at all. So we definitely need that. And I saw as well Mike or Alex, he confirmed based in KL, so our assumption was correct that he is in a high humidity place. And he was mentioning struggling with the condo management or the office management. Nobody is interested. Feel free to get in touch. I lived in KL for a long time. When we think about these things of trying to change the behavior of people, we always need to come up with something that could be attractive for them. How about turning this into the most healthy condo in KL? Then getting the media involved with media attention. We always need to think about what is the condo management interested in or the office management interested in. They'll only be interested in things that gives them additional return on investment. So somehow finding that track and then maybe pitching it to them in that way, and maybe even asking uHoo for a pilot project with a free device or a couple of devices. You never know. Maybe they would agree. So great session. Thanks so much, Albert and Paeng. Thanks for everybody. I switched my video on again because my my internet connection seems to be finally doing okay. I feel like I can properly talk with you guys rather than being chopped into pieces. So I really enjoyed today's session. Thank you, everybody. Stay in touch. Hope to see you again soon.
Okay, have a nice time. Okay, thank you, Matthias, for this nice,
Albert.
very well
Thank you,
organization.
Matthias. Thank you, Albert.
Thank you. Bye.
Thank you. Bye bye.
Thanks.